My name is Christie Coad. I'm a certified athletic trainer and the lead regional medical provider for USA Track and Field. As a certified athletic trainer, we're dealing with pretty much all the ins and outs of what our athletes go through, either where they're training or where they're competing. I first found the InterX probably about 14 years ago, which makes me feel really old. But I had an athlete who was a multi, so she was a heptathlete, and she had several knee surgeries. But her last one, which was I think number six, she had some really bad post-surgical knee edema, and we were having a pretty difficult time getting rid of it. Like she even had to have it drained a few times. We had done all of the normal modalities and things you would do to get rid of swelling, but it was just really stagnant. And so I started doing some research and I came across an article and it had a protocol for literally getting rid of post surgical knee edema on the bike using an InterX. And I was like, wait, I think we have one of those somewhere. I was working at a university at the time. So I went over and I found it in a drawer and I brought it out and we did the protocol that the study had said was effective. And it really was. I would say we probably got rid of about 60% of her edema after two times of using it. And so after that happened, I was like, maybe I should learn more about this thing because it was clearly pretty effective for us in that situation. The thing that I like the most about the InterX is that it gives me actual feedback. So, as with other modalities, a lot of times you're putting them on somebody and you're just using the parameters that are recommended. Whereas the InterX, you actually get real time feedback when you're training an athlete, which is not just helpful for me, but it's helpful for my athletes, especially when you're working with elite level athletes. They're very in tune with their body, they know what's going on. And so, any feedback you can give them for the treatment you're doing and why you're doing it, and then also having them see results after is something that's really beneficial in our setting. The people who have noticed the most difference are people who have dealt with chronic injuries, just like the other side of Interix, where they're treating a lot of chronic pain syndromes and things like that. We're also treating chronic musculoskeletal or orthopedic injuries. And we have found that to be very effective. So people that are dealing with long term tendinopathies or maybe some scar tissue from a surgery they've had and things like that, something that has been really effective. On the flip side, for someone who's dealing with something like maybe an adductor strain that's resolved, we're running, but we're not feeling like 100%. Maybe we're 85, 90%. Those people we've used the Interix on as well, usually 24 to 48 hours out before their race and had really good results with that also. It's so easy to travel with, which is very important for me. I think I just told you I lived on a plane. The fact that I can put that in my bag and it's just ready to go with me is something that's really helpful. The biggest thing that we notice first is athlete feedback, because that's going to be at the end of the day the most important thing is, does the athlete feel like this is working? Does the athlete feel like this is helping them? And whether that is any number of things that they're feeling improvement on. Are they feeling better? Yes or no? If they are feeling better, they're going to be more keen on using that again. And we're going to make sure we implement that more into their treatment protocol. For me, I noticed like a difference in tissue tone tightness and really just their response to how they feel during movement. A lot of times when I treat someone the first time, for whatever reason, some athletes get off the table and they feel a difference right away. Other athletes don't feel a huge change until that 24 hours or within that 24-hour mark. And so those people, it's like, hey, you might not feel a big difference, but you might notice something when you wake up in the morning or whatever. And then you'll see them the next day and you're like, how do you feel? They're like, oh, yeah, I guess I didn't have pain when I woke up or as much pain when I woke up. One of the biggest things is that it doesn't overload the body because it's a stimulus. And a lot of like what I said, what we do is manual therapy. So we're doing a lot of soft tissue work, joint mobilizations, and things like that. But the InterX provides us an option to provide a treatment that's not going to overload a tissue. And it gives us another treatment option that's going to be something that's not going to be aggressive in the form of soft tissue, but also effective at treating and trying to achieve some of the things that we're doing with other manual therapies. In terms of modalities, for me, I've found that the InterX has been one of the more effective modalities that I've been able to use, specifically when I'm on the road traveling, Because although there's other modalities that are really effective, like shockwave and things like that, we're not generally traveling with those things. And it's not something you're going to do right before someone competes. So, although there's a ton of other things that are effective out there, this is something we can use right before a competition. Whereas some of those other modalities that we would get the same results with are a little bit more aggressive, or we may not be able to use right before a competition. It allows me to provide a treatment that's going to help decrease inflammation and help improve movement and decrease tightness, and do that without really digging into a tissue or using other manual therapy techniques. It resonates with elite athletes because they want feedback and they want results, and the InterX gives you both. And it gives you an actual number, like right there when you're treating somebody versus just having to guess about something. And when you're an elite athlete, you want all the feedback that you can get. These athletes, this isn't just their activity or their sport they're doing. This is a lot of times like their life and what they're doing, and this is their job. So anything they can do to improve their performance outcomes, they want to know about. And anything they can do to become more effective or have less pain or perform better, that's something that they want. And that's something we want to help them with. And so if they've found good results from using something, they're going to keep using it and learning more about it. I've had athletes reach out and get their own devices after using it. And so I think it's something that they really enjoy because of the feedback that they're getting right away, both from the device and then also how they're feeling.